Hi, everybody. I'm Barb.
Hi, I'm Jill. No, I'm Randy.
Hi, I'm Jill.
And then
This is our Sclero-What adventures. You guys, you would think that maybe it's a Friday afternoon, but who knows what day it is.
happy hour time.
It's 5 o'clock somewhere.
It's 5 o'clock somewhere, Jill. That's right. Awesome. Well, hey, everybody. Happy Scleroderma Awareness Month. We are so happy that you have joined us today. And we are welcoming Jill here with us today. Thank you so much for coming on here and sharing your stories with us every single day. We believe that the best way for you to get educated about scleroderma is to actually hear from the people that live with scleroderma every day. And so Jill has joined us today from Des Moines. Well, she's actually not in Des Moines. You're in Winterset, correct? Right. Winterset, yep. Iowa. So welcome, Jill. Thank you so much for being here. Tell us, what form of scleroderma do you have?
I have diffuse systemic scleroderma.
And when were you diagnosed?
I got my official diagnosis on February 18th, 2013.
Ooh, you know the exact date. I don't know that I know my exact date.
It was the day after my brother's birthday. That's how I remember it.
Okay, I was going to say, that's pretty good. I know it's March 1994, but I don't always know the date. Mm-hmm. February 18th. Okay. And tell us, what was some of your first symptoms?
Raynaud's was my very first symptom. I started out with Raynaud's about 6 weeks after I had a really bad upper respiratory infection and ear infection. The ear infection was so bad, my eardrums ruptured. About 6 weeks later, I had not had an ear infection since I was 4 years old, and I was 53 when that happened. And so then I started with the Raynaud's, and about that same time, I also developed carpal tunnel syndrome in both wrists, and I had an ulnar nerve entrapment in my right elbow. So I had surgeries to fix all that and everything, but the Raynaud's continued, but it wasn't diagnosed. I just had, my fingers were turning white and then they would stay white. I wasn't going blue, I was going white and then the burning red when I got circulation back, but I didn't know what all this was. And then in the spring of 2012, I started having a lot of reflux issues. And I had 2 kids that were getting married 9 weeks apart in 2012. So I thought it was just stress from these 2 weddings. But in November, I went for my annual checkup with my primary care doctor. And I was telling him, I think I'm getting old because my hands are doing this. And now look at there, and they're really stiff and swollen again. And I have acid reflux. So anyhow, he says, I think we better do some additional testing. And he called me a couple days later and he said, now, don't get on the internet. My primary care doctor, I have gone to him for now 25 years. So, and a small town, our kids are friends. We went to the same church. So anyhow, he says, I know you don't get on the internet. He said, but I think you have something called scleroderma. And I said, well, Kevin, I don't need to get on the internet. I know what it is. My dad's sister-in-law passed away from it in 1989. So then after some trial and error in Des Moines with with rheumatologists, I went to the University of Iowa, and I still go to the University of Iowa.
Yeah, the rest is history, right?
Exactly.
That's amazing that your primary care physician is really kind of the one that diagnosed you.
Oh yeah. Yeah. I later found out he had another patient who within like a year to 18 months prior to him diagnosing me, she had passed away from it.
Okay, so he had some knowledge of it.
So he had some knowledge of it. He is also an osteopath, and so he had a medical student from Des Moines University with him, and the student, my hands cooperated and did turn white while I was in there. And my doctor said, look at her hands, what do you think? And the student said, that looks like Raynaud's. And of course I had no clue what they were talking about.
Yeah.
So yeah, it was, but yeah, he knew what it was, but I kind of felt good that the medical student recognized Raynaud's as I look back on it.
Right. And that he could actually see it happening too.
Right.
Because our hands don't always cooperate like
No,
that.
they
It's kind of
don't.
like when you take your car
Mine-
into the mechanic and because something is making noises and then you take it into the mechanic and then it doesn't make the noise.
Right.
That's really what happens, right?
Yeah, it is a lot of times. Yes.
Yes. Well, tell us, Jill, what is one thing that you would tell your pre-diagnosis self?
Don't panic.
Mm-hmm. And so going on that, what is one blessing that Scleroderma has brought into your life?
Well, you too. All the it has to be all the people that I have met because of scleroderma, and I also found out that I am made of pretty tough stuff.
Absolutely. Oh, I love that. I love that, Jill. So tell us, what does Scleroderma Awareness Month mean to you?
It gives me the chance to really talk about what scleroderma is, to try and help, especially I really to help patients understand it even more. We have a lot of people that really aren't aware of it. I can also, it's another way to educate my family, my friends.
Absolutely. I 100% agree. And what is one thing, speaking of your educating your family and friends, what is one thing that you would want everyone to know about scleroderma?
Just because we don't look sick, just because we did something yesterday, does not mean we are not sick or that we can do that thing today.
Yep. Absolutely. Absolutely. I think the message that you just shared with all of us is so important for all of us to know and learn. And yeah, great job. Great job.
And you know, I always say that knowledge is power.
Absolutely. Absolutely. I think that maybe comes from our support group.
I think so too. I really do think that is where it comes from. I think more people, more patients who have access to support groups would benefit from attending. And now with them being on Zoom, you can attend anybody's.
I know, it's fabulous. Yes. So you want to do a little shout out? When do you have your support group, Jill?
We have ours the second Tuesday of every month. You can go to the Facebook page, Des Moines Scleroderma Support Group, and there is a link there that will take you to the meetings. They start at 6:30. They're supposed to end at 8:30. I think last night it was about 10 after 9.
So there you go, everybody. If you are looking for a support group, you are welcome to join Jill Connolly's in Des Moines. Just find the Facebook group, Des Moines Scleroderma Support Group, and second Tuesday of every month at 6:30. And it's a link. Just
We'd
join.
love to have you.
Absolutely.
And we'll
Yeah.
get it attached too.
Thank you, Randine.
You're welcome. And Miss Jill, Random Randine questions for you.
Get ready. We knew this was coming.
Anticipation.
I think she was trying to avoid them. Well, there's going to be a few secrets told today by Jill.
Oh, yeah.
The first secret, and it's going to help a lot of you people out there. Jill is a very good gardener and she has a green thumb. And so we were talking about what is the secret? What's her secret? And Jill, you want to share with everybody? You just figured out your secret too of what makes you have a green thumb versus me, who I don't have a green thumb.
Epsom salt.
Epsom salt.
I put a teaspoon of Epsom salt per gallon of water when I water outside. You're supposed to do it every 2 weeks. I do not do it every 2 weeks. I do it when I remember. I use it on my inside plants.
I'm going to try it.
I'm trying it too. Absolutely.
Please do. Please try it.
And I will tell you how it works.
And it's also great for scleroderma patients if you can still get in and out of a bathtub to soak in Epsom salt.
Yeah, true. Okay, so Jill was telling us her mom has been watching every day, so we should give a shout out to her mom.
Hi, Jill's mom.
Hi, Ruthie.
Ruthie! No crying, Ruthie.
No crying, Ruthie. It's all happy.
And you cannot ground your daughter with what she's going to say right now, too. Jill, so you have this time between Barb, me, you, and your mom watching to tell her anything you want to share about a secret that you've been hiding for, I don't know how many years. The one you told us earlier. Remember that secret you told us about earlier that you did when you were a kid? And your mom?
Randine, you're dreaming.
Ruthie, she was telling secrets of her childhood. We weren't really supposed to talk about it, but I felt now that we're the appropriate age, it should come out.
There's at this point in time, if there were any secrets, she knows them or they're not worth knowing.
That's a good answer, Jill.
No, she didn't tell us anything, Ruthie, but I wanted her to. Because we like to know stuff. But that's all I have for Jill. Thank you, Jill.
Thank you both so much for everything you do for us.
Oh, you are so welcome. It is honestly our honor and privilege. Thank you so much, Jill. And thank you, everybody, for watching us. Oh, bless you, Randy.
Bless me.
Bless you.
You guys have a wonderful day, and we'll see you tomorrow when we will bring you another scleroderma story for Scleroderma Awareness Month. Have a great day,
Bye.
everybody.